everybody, do you have a preference for a choice of broad spectrum antibiotics if a patient were to be superimposed with an infection while in the hospital with COVID-19?
I'll take an initial stab at that one. So really, in my head, whatever your hospital guidance is for your initial therapy for your sepsis patients would be where I would start. So for our institutions, our broad spectrum includes cefepime and vancomycin. With cefepime, we try to make sure that that's given first because it covers the most organisms, since vancomycin is fairly narrow for methicillin-resistant Staph aureus infections primarily. If there are allergies, you certainly have additional options such as ace-trionam plus metronidazole if you're looking for, if they have a severe penicillin allergy and can't use cefepime, or if you can't use ceftriaxone or Zosyn, piperacillin tazobactam. Beyond that, then you have the much broader or coverage with things like meropenem or linezolid, but you have to be sure that you were to make sure that they don't have any drug interactions, particularly with the linezolid and SSRIs with risk for serotonin syndrome. So there's a whole host of things. So that's where your pharmacist in the facility, or even an ID specialist, if you have a hotline that you can call if you don't have those specialties available in your facility, that can help you out.
Wonderful, thank you. Yes, our pharmacists are always saving us with drug interactions and choices for all these medications. So we definitely appreciate it from my standpoint.